Okay, let's talk about some birth complications or potential complications. Labor doesn't progress and might require some induction. So what does that mean? Well, they could strip or sweep the membranes. Okay, so you can see that involves inserting a finger and kind of providing some aggravation as an attempt to induce labor. Some cervical gel can be inserted. This is often the first step in labor induction, and this is to intentionally attempt to thin and dilate the cervix. Pitocin, which is a synthetic form of oxytocin, can then also be given to induce labor. Now, this is going to induce uterine contractions, and you don't want to do that until the cervix is thinned and effaced, so which is why the cervical gel is an important piece of the induction process. Giving Pitocin without a cervix that is thinned and effaced would be problematic. So what are some other complications? Preeclampsia, which would be in the birthing parent. This may require an emergency C-section. Symptoms are protein in the urine, swelling, and then an extremely high birthing parent blood pressure. If the baby is presenting sunny side up, so you can see in a natural position, the face of the baby faces the back of the birthing parent. And sunny side up, the baby's face is facing the same direction as the birthing parent. This can cause prolonged labor, a greater risk of tearing, greater risk of C-section, and it also can result in painful back labor because the baby is literally not positioned in the way that labor is supposed to progress. A much more rare presentation would be face first. So you can see in that illustration, face first means that neck is hyperextended, and so what is presented is literally the face instead of the top of the head. Okay, so this can cause some birthing trauma due to the positioning of the baby, and so great care has to be taken in this delivery. Aside from face first with that hyperextended neck, there are a whole slew of different breech positions. So there's a frank breech that's butt first, but there's, you can see how the legs are bent up. There's complete, so in the position with flexed arms and legs, but it is a butt presentation. Transverse, so it's the side, or could be a foot, all right? And there are a great deal of variations in between, okay? Sometimes this may require a C-section. So here's birth of foot first, okay, one of the breech positions. There can be shoulder dystocia. Basically, that means the shoulder's stuck. This often happens with larger babies, okay? So again, baby face down, right, toward the back, comes out, and then there's the head turn to kind of do this little shoulder adjustment. If the shoulders are particularly broad, or even if it's just a large baby, those shoulders can get stuck and impede the delivery process. Sometimes there needs to be some assistance to get the baby out. That can result in some injuries like a broken collarbone or much more serious. We have a nerve pathway, the brachial plexus, that runs under your arm, and that can get damaged, resulting in some paralysis. So obviously we want to mitigate that risk. We can have a knuckle cord wrapped around the neck, okay, which is problematic because it could potentially cut off circulation to the baby during the delivery process. There's cord prolapse. That means the cord is coming out first. And the reason this would be problematic is as the baby is moving through the birth canal, compression of the cord cuts off blood supply, cuts off oxygen to the baby. So that is definitely problematic. Okay, let's look at placenta previa. So here is normal placenta placement. So up near the top or the upper side of the uterus. Here we have a low implantation. Okay, here though, here is the vagina and the cervix. You can see the placenta is implanted very low here, and here it is completely blocking. In those cases, the placenta would obviously be delivered before the baby, which would be problematic because birth can sometimes take hours, and the placenta is not going to continue to provide nutrients once it is detached, okay, for very long. So in those cases, it most likely requires a C-section for the safety of the newborn. You may have heard of meconium. So meconium is the earliest stool, and it looks like this. It's like dark and tarry, right, like this, okay? So it's got all this stuff from when the fetus was developing in utero. So it's got like some intestinal epithelial cells from the lining. It's got lanugo, mucus, amniotic fluid, bile, water, all kinds of stuff. Normally, that's had after the baby is born. If the first bowel movement is had before delivery, it mixes with amniotic fluid. And the fetus practices swallowing, does all kinds of things to get ready for birth. So that can be inhaled in the delivery process or even before. So a baby born where there was meconium in the amniotic fluid is going to need some suctioning to make sure that all of that gets cleared out. Remember, they haven't breathed yet, okay? So it's not, ideally, it's not going to be very far, okay? But we need to make sure that it is not going to be breathed into the lungs, resulting in some pneumonia or other infection. Fractured clavicle, again from the birthing process, because face down, turn, and if there's a large baby, it can result in a fractured clavicle. Assisted delivery, there's vacuum extractor and there are forceps. Both can be used for a labor that is not progressing. Okay, there's tearing. So here is the vaginal opening and here's the anus. And you can see this is a minor tear, first degree. Okay, here we have tearing that includes some muscles. Okay, next level of tearing, we include the anal sphincter. In the most serious type of tear, it involves the rectum as well. Regardless, tearing is going to involve stitches, and you're going to use dissolvable stitches, so it's not something that has to go in and be removed. But there are ways to try to limit this tearing. So there could be some perineal massage, okay, as labor is progressing. There are other ways to help prevent tearing. So speak to someone if this is a concern of yours. Sometimes people will choose to do an episiotomy. Now, an episiotomy is not going to cut typically along the same line as it would be from the vagina to the anus, often cut like this, off to the side. The purpose is to create a larger opening for the baby to be born if there are difficulties in labor. There's a lot of controversy about whether or not this is a needed procedure or not, but definitely talk to your medical professional. Okay, there can be hemorrhaging after birth, okay? And this is related to the birthing parent. So normally what happens is after the delivery, the uterus continues to contract and get smaller. Because think about this, the placenta is like ripping off a giant scab. So there's a lot of bleeding that is going to occur, okay? Now, the more the uterus contracts, the sooner the bleeding is going to stop. Now, sometimes after delivery of especially a large baby, the uterus is like, I am exhausted. So sometimes a birthing parent might have to be given Pitocin after delivery to induce that uterus to contract. Also, fun fact that I learned after the birth of my first child is that this hemorrhaging after birth is more common in redheads. So if you are a redhead, you have a large baby, puts you at greater risk, which I didn't know before going into that delivery. Okay, so again, we have a wound in the uterus from where the placenta was, and it's going to bleed. The uterus needs to contract to stop that bleeding. Pressure on the uterus can help to stimulate it, but so can Pitocin. A C-section might be required, okay? And a C-section is going to have now a very small scar, just low in the pubic area, and delivery of the baby through that small hole. If you think about it, though, is a 10-centimeter dilation of the cervix that would be in delivery, so it does not need to be a gigantic incision. All right, so C-section birth. C-section birth, okay? So this is obviously a little bit different, and the anesthesia is different. Typically, it's a spinal, similar to an epidural, but it wears out in a specific amount of time, whereas in an epidural, you can kind of adjust. Some people may choose to have a VBAC, and if you don't know what that means, it means a vaginal birth after cesarean. So you had a cesarean, see, there's that low scar, and then are pregnant again and would like to choose a vaginal birth after cesarean. These are entirely possible options and very common. Just speak to your medical professional. Having multiples is kind of a risk. Okay, so there are greater risks for both the developing fetus and the birthing parent. So things that are more common: placenta previa, high blood pressure, risk of miscarriage, and premature birth. So those are risks with all multiples, but there are varying levels of risk depending on the number. So we could have fraternal twins. So that's when you have one egg fertilized by one sperm, and then you have a second egg fertilized by a completely different sperm. So each egg was fertilized by sperm. So these two children are no more related than siblings. Okay, they just shared the development inside the uterus at the same time. Okay, identical twins. So this is one egg fertilized by one sperm, and then at some point early in development, it splits, and then two separate individuals are created. And then aside from twins, there are triplets, quadruplets, quintuplets, a lot more. Obviously, as the number of multiples increases, the potential risk increases, especially for having a smaller baby when it's born, and potential complications for the birthing parent. What is important to realize is that taking fertility drugs can increase the risk of having multiples, but that is not all. Also, the age of the birthing parent does increase the risk of having multiples, and it can occur with or without family history and without any fertility drugs. So I did meet someone who had a 2-year-old child and was pregnant with triplets who had no family history of any kind of multiples and was not taking any fertility drugs. So it absolutely could happen at any point. It's just random. And those are some of the complications associated with birth.